Hey Dallas, Dr. Brian here with Dallas Energy Chiropractic, and I have a guest. Please introduce yourself and let Facebook world know who you are and what you do.
All right, so my name is Dr. Robin Abramczyk. I have a practice out in Heath, Texas. It's named Smile Ranch Dentistry, and I'm a biological dentist and a naturopathic physician.
Awesome.
Yeah.
Okay. So in our practice, Dr. Brittany and I, we have a lot of patients that come in. We see a lot of infants. There may be some kids in the background. We love it. We're all part of this. So just ignore them when they're there. But we're here. Ask questions and participate, please. But a lot of our kiddos come in and we get questions about feeding and sucking and all this other stuff. And so Dr. Brittany and I have become very aware of, and in part because of Chet, of what we call TOTS or tethered oral tissue, often called lip, tongue ties, and other stuff like that. So tell us a little bit, explain to moms, parents out there what that is, and let's start there. What is it?
Yeah. Okay, so a TOT is a tethered oral tissue, and typically that's thought as of a tongue tie, but in almost 100% of cases, very close to 100%, if there is a tongue tie, there's also a lip tie. And even beyond that, we also look for buccal ties, which are the little attachments between the cheek and the bone or the alveolus. So as a practitioner, whenever I evaluate an infant or even a child or an adult, not only do I look for a tethered oral tissue under the tongue or a tongue tie, but I also look for an upper labial tie and buccal frenula. So those are 7 sites that I look for and evaluate on every patient that I assess.
Okay, very cool. Now, so our son Chet was born. He had trouble feeding. That was the first thing, right?
Right.
Trouble sucking, essentially, and so we got a lactation consultant. Thank you very much. Yeah, and so she looked, and she found a lip and a tongue tie. Now, is that something that's real common? Do they typically have trouble feeding, or is there other symptoms or manifestations that a parent would look for?
So that is a very loaded question. So first of all, what Dr. Brian was explaining is that he had an evaluation by an IBCLC, which is an International Board Certified Lactation Consultant. I highly recommend that you have an evaluation by an IBCLC, not only an IBCLC, but someone who specializes in tethered oral tissues, because they're not all trained the same. It is over and above all the training they had. And by the way, an IBCLC has thousands of hours of training. They're highly intelligent and highly specialized in what they do. And so we want to ensure before we do a release, we have a rationale to do a release. Now, I have not been trained I've been trained a little bit in breastfeeding medicine, but an IBCLC who's been trained in tongue ties and tethered oral tissues have even more training than a regular IBCLC or a provider who does the releases. So their intake form is extensive. So we want to ensure the rationale would rule out other things that could be causing feeding issues. So, for example, if mom has hormonal issues, has she had shoulder surgery so that the nerve that innervates the shoulders and also the breast, could there be an issue there? Does she have postpartum depression? And so these are all very imperative issues that need to be evaluated to ensure that whenever the baby comes to me, that we know that is other issues that could have been addressed without having to put your baby through an invasive procedure prior to having a release.
Okay, so there's an extensive investigation into this.
Absolutely.
Okay. Awesome, great to know. And so you mentioned there's 7. Is there one, and you typically said that not only is there a tongue tie, but there's lip ties, is that as well? Okay. And what percentage, I read our research article that said about approximately 9 to 12% of the population has a tie. Is that pretty accurate? Is it a little high, a little low?
Yeah, I think it's really, I hear that it's much higher than that from other midwives. It's really hard to tell, but I have read that in the literature. I've heard even up to 30%. But statistically, it's really hard to tell. But number one, you want to have a functional evaluation from an IBCLC And if you're having feeding issues, then definitely that, and then to follow up with a provider who does releases. Yeah.
Okay. So aside from feeding, though, what else have you seen in your experience? Is it feeding and something else? Is it predominantly feeding? Does it affect swallowing?
Yeah.
Breathing?
Yeah, and so essentially the etiology has to do with the fascia of the body, and a lot of our body workers, for example, some of our chiropractors and a lot of people who do craniosacral therapy are very attuned to that. So there's fascial planes that run through the body that start with the tongue. So there's one that runs from the tongue all the way down the front of the body, and two that go down the back side of the body. You're asking about essentially what else could it be other than a tongue tie? Is that what you're...
No, just, I'm part of a tethered oral group in Texas, right? And many of these, it's typically moms, but many of these moms are confused. Is it, am I looking for what would I experience, right? For instance, what I've heard one or several moms say is they'll notice that their nipples are very tender because the baby's sucking so hard, right? Or try to.
Very, very good. Okay. So I see what you're saying. So, so some of the symptoms, like you said, it could be nipple pain, bleeding, mastitis, frequent feedings, or baby becoming fatigued during a feeding and falling asleep and frequently nursing or nursing for a very long period of time. We'll also see where a baby will be clicking, and that's part of breastfeeding mechanics, where why would a baby be clicking? Well, if it's due to the tongue tie, that would be because there is a suction that forms, so the upper lip would flange and form a seal with a wet mucosa of the upper lip, and then the tongue, as it elevates and presses the nipple to the palate, as it lowers down, it creates a vacuum. But if they can't elevate all the way up and press up to press the nipple to the palate, there'll be a clicking as the tongue lowers and forms a vacuum. So the baby will compensate. So that's what we're talking about, is structural limitations that result in compensations. So like bleeding and mastitis, all of these are symptoms that the mom could have, or severe pain, poor weight gain, but sometimes mom might not have any symptoms. My mom might not have any pain, and it might just be symptoms that you notice with a baby, such as colic, because of swallowing air, like aerophagia. So it has to be really an IBCLC who's intelligent in their assessment. That's very difficult for moms, especially those who are suffering from postpartum depression and they're sleep deprived and they have raging hormones going on, and so they really need an intelligent provider who can give them that support.
Interesting. So there's a lot that can happen, okay? It can affect mom, it can affect babies. We get lots of babies with colic issues. That's one of the first things that we're looking for. So it's affecting digestion, it's affecting feeding. That is a great point about the frequent feedings. So they're not getting a lot of nutrition, correct? They're not feeding well, so they're constantly going back. So there's poor weight gain. That was one of the first things we looked at for Chet too, because he was struggling and he wasn't gaining weight back real quickly, and so we started to have to investigate this, right? So very, very good. Okay, so let's talk about age. Is there, do you need to wait? Is this something you should investigate right away? Sorry, invite came through. Right away? Do you wait a few weeks? Do you wait till they're 7? What's the, is there a timeline?
Yeah, so, the recommendation is the sooner the better. Like, absolutely, because the longer you wait, the longer you have to retrain the tongue how to function. And say you want to intervene early in the breastfeeding stage, but then after, down the road, you will start to look at perhaps feeding issues. So like maybe in a 2 or a 3-year-old, they're having problems with with solids or with certain consistencies, or they're choking.
Okay.
And then the next phase typically is as the teeth start to come in. So in primary teeth, we want to see spaces. If there's not spaces, they're tight, and statistically 50% of the time, if they're crowded in the primary dentition, they'll be crowded in the permanent dentition. And then once you get into that phase, it's kind of like, you're looking at orthodontic issues, which, by the way, all of this is coming back to the airway, which is, for me, it's so huge. Like, whenever a baby's born, you want to check their APGAR and, like, are they breathing? Yeah. Are they going to be able to eat? like so important. Look at their airway also. So, there's different phases, the breastfeeding phase, the feeding, speech, and then orthodontic.
Very interesting. So I've had. Let's talk about the one case I sent you in a minute. But
yes,
for instance, I do have a little kiddo who I know for sure has sensory issues. But prior to coming into the practice, he'd been diagnosed on the autistic spectrum. Okay. But when you interact with this kiddo, he does not have social behavioral issues. He communicates very well. He's just a little shy. But one of the things that I looked at first thing was his lip and his tongue, and they're both tethered. And so, you're having teachers say, or you're saying his speech is not up to par, but when your lip and your tongue, and I only looked at those two, I know there's 7 points like she mentioned, but I only looked at those two, they're tied down. And so you can imagine as you grow up, right, and you're trying to articulate something, right, and move your lips and your tongue, mine is not tethered. It's very easy for me to do that, but for him, it's difficult. So let's talk a little bit into the sensory world. So let's just say the kid's a little bit older, for whatever reason the diagnosis was missed, and now they're having sensory issues. Is this something that a parent of a kid with sensory issues may want to look into?
Yeah, absolutely. So one of the other things that we see quite often is patients who have been diagnosed with an MTHFR mutation. That is very common to see tethered oral tissues in those patients. And then we know they're poor detoxifiers. So, patients who are, like, for example, heavy metal toxic, they're more susceptible to, because they're poor detoxifiers, to heavy metals. And, this can definitely, if there's an overload of toxins, it can result in sensory issues. So absolutely, that is definitely something that I would look into, and then also create a team, an intelligent team of support around the release if that's indicated.
Okay. So one of my things working with sensory kiddos, sorry, we're trying to both fit into this video. It's not very, half of our heads each time. But, I have to look at, is the brain receiving enough input? And you have to think, this area is so heavily innervated, right? How much is this impacting their diagnosis? And so let's kind of talk about that a little bit. Have you seen success with kiddos with sensory issues after a release? And maybe what have you seen in that?
Yeah. So, and interestingly, we have another kiddo, and he's in his early 20s, and we'll be releasing him this month.
Wow. Okay.
But he also, again, I'm honestly, like, people like you or a naturopath who provide that extra support. I'm more procedural, so, like, I feel like really the magic happens in your hands or a naturopath's hands who can detoxify that patient and give them the raw ingredients, the cells, the raw ingredients that they need. And also another big piece of it is, if they're tethered, they're going to have a restricted airway. Like, absolutely. The craniofacial complex is not going to be really where we want it to be. And whenever they're sleeping, they're not getting the perfusion in all of their cells that they need. They typically grind, and whenever they grind, it creates a focus or a block of energy or chi, and it shuts down the glial lymphatics in the brain by 50%. So, like, we're talking about the MTHFR, poor detoxifiers, and then they're fighting an uphill battle. They're not getting perfusion, and they're shutting down their glial lymphatics by 50%, and it's really challenging. So it creates, or we need to create that team around that patient to offer that care and that support.
Wow. So let's talk about the young lady that I sent to you. Okay, so she has sensory issues. I think I've been seeing her now for close to 2 years, but always have had a postural issue, lots of restrictions, just kind of. And, through kind of working more with this and looking more into this, investigating this more, I started talking to them, and I looked at her tongue, and that's not my world, but it looked very heavily tethered.
It is.
And so I sent her your way. And part of the reason it was because I have found that pediatricians and ENTs and even some dentists are not really listening and hearing the parent's voice when they're saying there's something going on, right? They're very picky eaters. There's all sorts of, they're not articulating well. They have trouble breathing, all this other stuff, and so there's crumbs there, right, leading you back to this. And so I sent her your way because we had talked, and you and I agree, this can impact her life, right? And so I sent her your way. So tell us from your perspective what you found.
Yeah, so her tongue is absolutely tied.
Yeah, it doesn't even stick out of her mouth, I don't think, at all.
No. And not only that, but, we're talking about the cranial complex, and you're talking about posture. So the tongue. So if you can imagine from a profile, like this young lady, she's absolutely beautiful. Can we say what she does? Like she's a very, very gifted
dancer. Yeah, very, very.
Like beautiful. But she's very mandibular deficient. So your mandible is your lower jaw. So she's like this. And she's like this. And imagine a dancer needs to do. And we all should do nice flexion and opening of the airway. But she's like this. So imagine how much that has inhibited her capacity to do what she needs to do. So yes, absolutely. Functionally, her tongue, it's like to the end, like it is completely tethered. Her airway is restricted. Her cranial complex is restricted. Her palate will be vaulted because the pressure from her tongue is down low. It's not up in the palate where it should be. So many things that she's been fighting this uphill battle all of her life, and she's been compensating.
Yeah, and I know, I don't remember all the practitioners that she'd seen, but there were multiple that acknowledged she had it, but didn't think it was an issue. And I'm talking to mom, and we're talking about clearing food. She had difficulty clearing food, and what I have found when you talk to people, especially other practitioners that are familiar with this, and a lot of chiropractors and groups that I've been in, they've said, they're taking their sons and daughters are having symptoms, right? Headaches, migraines. Maybe they're constantly having to be adjusted, like just repeatedly over and over again without any significant benefit or gains, right? And they take x-rays and they find out they have a tie, and you can literally see the curvature pre and post, because it's not just a tongue. There's a big fascial plane that goes all the way down, and it goes all the way in. There's points in the skull and along the spinal cord that are tethered to, or they're tied to it, right? Maybe not directly, but down the chain. And so you can think of it like having a solid anchor point, like your boat, and it's anchored down. That boat will only go so far, right? The anchor is not going to give, especially if it's locked in very tightly. And so this young lady who's a dancer had trouble coming up and out, right? Like she should. She's stuck in this flex position. So I don't know. Have you spoken to them recently?
I haven't, just the evaluation.
So I just have to say, I saw her last week, and she said just the little things that y'all had given her, some of the exercises, had already improved her stamina. And she's dancing all the time, like 5, 6, 7 days a week, right? So she doesn't have a stamina issue, or at least you would think. But when you can't breathe,
right,
it impacts you. So she's like, I already have more energy. How cool is that? So, and there's no release yet. This is just the added things that you've helped with. So, very, very cool.
Very exciting.
That changes a life right there for you.
Yeah.
Okay. So, and one thing I do want to talk about a little bit, since you mentioned the tongue being up in the palate, help anybody who's watching this kind of understand that. So, because I would get the impression that and we could talk a little bit more about this, but I know if the tongue is at the top, it's attaching to the palate, that's a very parasympathetic relaxation healing mode. And if your tongue is tied down and it never gets up, that's going to have some really stressed out kiddos, whether or not.
Yeah.
And do they tend to be mouth breathers then too if it's tethered down?
Yeah. So it's let's go back to the tethered tongue. Tongue is low. Ideally, we want the tongue in the palate to get nice, not only palatal expansion, but maxillary, and the mandible is going to rotate.
Oh. Don't worry about that as a power mode.
So the maxilla is going to expand and move forward. Mid faces forward. What will that do to your airway? It will open your airway. You'll also get the mandible, so it's going to translate and then rotate forward. So you're going to get maxillary and mandibular forward movement, which is ideally what we want to see. There's some other things like the angle that's here at the nose and the lip. So you don't want it to be a wide angle. You want it to be more of a narrow angle as everything moves forward. And what does that do to the airway? It will open the airway. If you have a low tongue posture, then you're going to have a very vaulted palate. It's going to be very high. That will invade the sinus, the nasal sinuses. We quite often will see a sinusitis in children. They're going to be mouth breathers, and so if they're a mouth breather, it's going to create xerostomia or a dry mouth. In those children, we see a very high caries rate because the saliva has salts that help to neutralize the acidity. So whenever we eat, and also bacteria give off acids as well, so it lowers the pH, but the saliva washes, it clears the food, it clears the bacteria, it helps to neutralize the acid, also has very helpful enzymes. And again, you'll have the vaulted palate. You'll see a lot of crowding. You'll see a mid-face, always mid-face, but definitely a mandibular deficiency. And what you don't want to do is go to an orthodontist and they extract teeth. Like that is not at all. You want to intervene early. And some people are like, why would you intervene? Why would you put a child in ortho whenever they're in primary dentition? But that is actually what you want to do because you want to have the greatest growth potential and affect change while they have the greatest growth potential. If you're doing ortho, say in our age, there's not a whole lot of growth potential, but doing ortho in like a 3-year-old or a 4-year-old, if they can tolerate that, is ideal. But remember, these kids are going to be not very desensitized in their palate, so their gag reflex is going to be a lot more active. Not only that, so imagine a narrow airway. So in order to open their airway, we'll see a forward head posture. And he's talking about the curvatures. There's 2 natural curvatures of the spine that we love to see. And a lot of that happens as we can lift our head. So tummy time, lifting our head as infants and babies, it's very important. And you start early in life.
Yeah, absolutely. I just read a article in Spectrum today, and they were saying that they're underestimating, or they're ignoring, is what they essentially said, the mechanical deficiencies in kiddos with autism. But we also know that posture is related to ADHD. One is sleep. So if you're a mouth breather, it means you're in sympathetic mode.
Yes.
And you're not breathing well.
Right.
Okay? So that alone be affecting or causing ADHD. Absolutely.
Yes.
Secondly, if it's tethered and their posture's distorted and you're not mechanically moving and you're not getting the neurological stimulus that you should through proper curvature and proprioception, could you have ADHD symptoms? Absolutely. But it's making me wonder how many kiddos out there with autism are not progressing, are not seeing, they're not developing because they're tied down as well. Because in my opinion, when you tie this down and you lose all that sensation, that input to the brain, on top of what it does to the spine, you've essentially stripped a child their sense of self, right? And so this is what you see in kiddos with ADHD and also autism. So
yeah, that's very interesting. There's been a lot of misdiagnosis of ADD or ADHD because these kids are not getting restorative sleep at night, and they're having this mouth breathing. We often see bedwetting, behavioral issues when they're exhausted and they're in fight or flight or running from bears all day long.
Yes.
They're exhausted, but they're used to it. They don't know that they're tired. So imagine affecting change early in their life, and they're like, oh my gosh, I feel rested. I feel relaxed when I wake up in the morning. They perform better. They immediately stop bedwetting, and it changes their world.
A lot. I mean, that's a lot, right? And so obviously the work that we do works in conjunction together, right? In freeing that up and releasing that neural tension. But isn't that crazy that a tie in the mouth could affect the cord and the tension and all of that and cause bedwetting? So very, very interesting stuff. Okay. tell me about a fun case. We'll end here pretty soon, but tell me about something. Like you have to have, there's always a case or two that
I have some fun too. So like two of my favorite are adoptive cases where, and again, I'm more procedural, and so like I just really admire my body workers and my IBCLCs so much because they're like so highly intelligent. They're brilliant. But we've had a couple of adopted cases where they're non-biological children where they were able to nurse, and I think that's amazing. We've had babies that absolutely refuse the breast, and after the release and the magic from the IBCLC and their body worker, they were able to go completely exclusively back to the breast.
Wow.
I think that's amazing. I've had babies that have come on and that come to us and they were on Zantac, so like an anti-acid.
Yeah.
And from reflux.
Reflux, yeah.
And we did a release, and again, our body workers and like teaching consultants did what they do, and they were taken off of the medicine and they breastfed beautifully. We've done thousands of these cases, and I mean, there's so many heartwarming stories that just, I mean, it really does change lives, really and truly.
Yeah, absolutely. Incredible. All right. I'm trying to think. I don't have any more questions off the top of my head. Is there anybody out there in Facebook land that has a question? We'll give you a second to answer. Type it in if you do. What is there, I know we touched on this a little bit, but is there any age in which you think that you wouldn't release? Or is there, let me ask you this. Mm-hmm. Are there any releases where you're just like, I don't think that's affecting them. We're just not going to do that? Because I had a colleague, and he said he didn't believe in this, and I kind of challenged him, and his argument essentially kind of boiled down to was I have a daughter who I can't, if it's a tongue or lip tie or both or whatever, and essentially, and I don't like this argument, but this was his argument, was that she, after a few months, essentially adapted to that. Okay, and the reason I don't like that, and I'll explain that real quick, is you don't really adapt to something, you just kind of switch, right? And this is where I commonly hear it, not so much in the ties, but it's in the crawling. And they'll grow out of it or something else like that. And we know if you don't crawl properly, if you scoot or, you go straight to standing, that's a sign of some things. But we know that you don't have that good cross connection between the hemispheres of the brain. And typically these kids will struggle somewhat in school, right? It depends, or they'll have some sort of issue academically. So, the whole rant, I forgot what my question was.
No, you said, are there any cases where I wouldn't?
There we go.
Okay, or like the adaptive thing. So, like, it's a two-part question. So, if they are tethered, they will compensate, and it's not ideal function. And the sequela, or down the road, the negative outcomes of being tethered and not releasing it can be detrimental. They can, end up with ortho issues, with feeding issues, with breastfeeding issues, with texture issues, with postural issues, and like really, if an open mouth posture, which leads to very strong correlation between an open mouth posture, mouth breathing, and obstructive sleep apnea, which scares me, y'all. It's not cute when a baby sleeps with their mouth open. That baby's dying, like really and truly. They need to have their lips together, if they have teeth, their teeth together, their tongue and their palate. They have to have that. If they are OSA, obstructive sleep apnea, there's other comorbidities such as diabetes and hypertension, and those words scare us. But look, it is on a scale, and is like, we start over here. If we intervene, they're at very much of a low risk of developing these. But if they don't, isn't that scary? And just because someone is thin like me and athletic, I still see patients that have OSA that are my age, that are athletic and that are thin. So, it's very important to look at all of that. I've heard that too, and I hear parents come to me, and I love, like, mamas, please listen to your gut. If you know something's wrong with your baby, listen to your gut and find someone who will listen to you and respect you. Because I have patients all the time who say, their pediatrician said there's nothing wrong, or their initial lactation consultant said there's nothing wrong, and then they find the right person that is like, absolutely, your baby's tied. So listen to your instinct, because most of the time it's right.
It's very good. And the group that I'm a part of, Brittany and I are part of, at Texas Tots, essentially. You hear this over and over again. I've seen many moms, comment, "Hey, I was told by my pediatrician. Hey, I was told by my dentist, or whatever. This is not a big deal." And I'm not a dentist, and I just look for them and I refer them out. But you only have to see one or two, and then you're like, that's what that is, right? It's not. It doesn't hide itself. Most of them are fairly evident from what I've seen. I mean, their moms are snapping pictures, and you can, unless you have no idea, absolutely, if you've never looked inside of a mouth before. But my wife and I have. It is very, very evident. All right, Dr. Brittany's got a couple questions for us. Let's see. Have you seen any connection to food allergies and lack of digestive enzyme function due to a lack of oral function? So, have you seen a connection to food allergies and enzyme production due to TOTS?
Not sure about enzyme function, but I would think that if their oral function is not optimal, that they're not, say their teeth are not function or not into occlusion the way they should, or their bite is off. If they're older, so like every cell depends upon your teeth to function properly, so that it can start in the oral cavity and break down their food, so that then it goes on to the next stage, into the stomach, into the small and large intestine, and then that, of course, will affect so many different things in your body. So every single cell, your immunity, your serotonin level, all of that, which is the gut is the second brain, is what we call it.
Yep.
But I'm not sure about digestive enzymes. That's a great question. Could you also touch on your thoughts on people saying it's a small tie, it's not a big deal? I don't agree, because theoretically, if there is a tie, it will inhibit function, which can cause so many different issues that we've discussed. So a tie is a tie is a tie. It needs to be released, so that there's no compensation, and so that we can get a nice craniofacial complex growth and development.
Yeah, absolutely. And we say that too about chiropractors call it subluxation, right? That's where the spine is not functioning properly, the vertebrae aren't moving. Yes, you may have one, but that one affects the entire chain, right? And so one can impact other levels, and eventually over time, that compensation will lead to something, right?
Yeah.
It'll lead to degeneration of the spine. It'll lead to headaches or migraines, some way, somehow. And this really points to the beauty of the body and its ability to adapt, right? Because, yes, they have a tie, and they adapt to that type. That's wonderful. I mean, in that sense that, 150 years ago, 200, 300 years ago, they had to adapt, right? There was nobody looking for this stuff. But now we do. Now we know about this, right? And so we can't be ignorant on this topic anymore.
Yeah.
That we need to start addressing these things. It's the same with chiropractic. Yes, a kiddo falls, difficult birth. Yes, it's a small subluxation, but over time, it will lead to other things. And so nothing is small in this area of neurology.
No, you're absolutely right. And I love what you're saying about the sympathetic on versus the parasympathetic. So like I'm telling you, whenever we do, there is a switch that happens when we do a release from sympathetic to parasympathetic. Even though the baby cries, we always use topical. Your doctor better use topical. If they don't, that's not nice. But there is definitely a switch. And then also we're talking about fascia and the planes that run down the body. There's also a fascial web that wraps around every cell in the body. So not only you're talking about autonomic nervous system, but you're also talking about the fascial web that wraps around every cell in the body. And then one more thing that we did not address that you asked is, have there ever been cases where it wasn't, I just didn't feel good about doing the release? Yes. And those are ones where I have so much compassion and grace for people, but sometimes mamas have to go back to work. And if they are not able to do the stretches that we recommend, I don't feel comfortable doing the release, because they're going to waste their money. We put a sweet baby through an invasive procedure, and I want to ensure that they are able to do everything that they need to do so that they have the best chance of an outcome. And I require on my breastfeeding babies, I require an IBCLC report. Yes, it costs money, but I think it's bad medicine to do a release if I don't know for sure that I have a real rationale to do a release. Because what if all that baby needed was an IBCLC to say, hey, try a football hold, and that's it. That's all they need.
Okay. So there are scenarios where maybe a tie is not, or a release is not beneficial, and not only because mom doesn't have the time to, because let's go into that just a little bit. Let's touch on, and we can go into this later on, but so when we had Chet's ties released, we had to, every 2 or 3 hours? It was regular. I don't remember exactly the time.
Hours, yeah.
But we had to go in there. I couldn't do it. Brittany had to do it. Big hands. That's my excuse. My hands are too big. But in reality, I just couldn't handle them crying. But because they do cry. But you had to go do some exercises. So if mom, because I've seen a couple moms ask about this too, if they don't do the exercises and every few hours, those will re-adhere.
Yes, absolutely. So, for example, if you bite your tongue, you bite your cheek, you know how it heals so quickly? You're like, I can't even tell I bit myself. So that should tell you that those cells in the oral mucosa, which is attached to your gut, so it's one tube, those cells turn over quickly. And, you know, for example, I did a release on my hygienist. I can't ask questions on a 2-week-old, but I can on my hygienist. I won't say how old she is, but she said that she let the night go by after I released her, and she started to see bands develop. And so we need to, so my instructions are an eight weeks of stretches, and the first 3 weeks I recommend stretches 6 times a day at regular intervals, and like even one during the night, because they will reattach because our beautiful bodies are able to heal so quickly. So very important. And by the way, one topic that this is for another day, but on as far as pain management, you want to make sure your baby's comfortable. So pain management is important. And if we use like Tylenol, for example, you're going to deplete your glutathione system. So I recommend homeopathy, which I have, but I also want my babies comfortable. So there's different things that you can do for pain management. But yes, make sure you're doing those exercises. I say 6 times a day for 3 weeks, then 5 times a day for a week, then 4 times a day for a week, and so on, for a total of 8 weeks. But in the literature, it says that the oral mucosa cells during oral wound healing reorganize for up to a year. So that's where I try to really, really, really encourage my nursing dyads to go see a practitioner like Dr. Brian at least for a year, or until whenever they say that you're good. Okay, because those cells, it takes for up to a year.
Wow. So Dr. Brittany works a lot with fertility people, couples, I should say, not people, couples. And, she works in 120-day cycles as the cells turn over. So that's really interesting. I've never heard that. So that's, it makes sense, but it's just things that, you're always learning. So that's really cool. And that helps me from my perspective too, also learn. We know lots of things. We know that the ties are affecting posture. We know that statistically speaking, kiddos with diagnosed with autism tend to have cranial issues. So they looked at them, they're less symmetrical than their peers. So you have to think that this is playing it into this, right? I'm not saying it's the end all be all. I'm not trying to point, this is it. But you can imagine that these kids are having this, and it's affecting their cranium, which is affecting brain development, which is affecting CSF, all of this stuff. Secondly, I got some other cool research we should talk about later on. All right, any other questions out there that we can answer for you? Thanks, Brittany, for all the good questions. We get this all the time, so I'm glad you wrote those down. If not, so if you're watching this later on, tomorrow, Friday, Saturday, Sunday, doesn't matter when, please comment, okay? And one of us will get back to you, or both of us will get back to you. We want this is about you answering questions for you to help you make the best decision for your children. So, look, there's never too late to ask a question. If you see this in a year from now, please ask the question, because your kiddo will still benefit. We can still help out, but please ask those questions. If you know any parents that suspect this, kids are having trouble feeding, the colic, bedwetting still, maybe ADHD or ADD, please comment, share, let them know about this. So I don't see any questions. Thank you so much for this. We're going to do this again. if you're watching this, please leave us a comment with something you'd like to hear about. Maybe more about this. Maybe we discuss more about tongue, lip ties, taunts, maybe something else. But please comment. And I'd expect in probably about the next 6 weeks, maybe right after the new year, we'll get back on and do a Facebook Live, and we'll go back into this and discuss some more. So please, if you have any questions that you'd like us to discuss again, please make sure that you comment. We'll respond directly to that, but we'll also maybe do a Facebook Live on it and answer more in depth. All right. If somebody wanted to get a hold of you, how would they do that?
Yeah, so I have an Instagram page and also a Facebook page, and I have a personal page. And my office is Smile Ranch Dentistry, and the number is 972-772-7645. I would love to entertain any questions or concerns. Any way I can help out.
Awesome. We'll have her comment and put that stuff back in there. That way you guys can just click and go from there.
Yeah.
But if there's no other questions, thank you so much for watching. We really appreciate it. We hope this was immensely beneficial for you, and we look forward to doing this again for you. All right. This is Dr. Brian with Dallas Energy Chiropractic. It's health by choice, not by chance.